wanted to talk about how one would use Oncoscope AI tool to stay up to date with the breast cancer information. There has been a lot of new publications of clinical trials in the last few months, especially with ASCO out there and with over 600 abstracts being presented at ASCO just in breast cancer. And in the meantime, of course, the world didn't stay still while ASCO is happening. So there were other things happening. The guidelines have been updated. The FDA has had several important approvals during that time. So, how do you stay up to date? How do you know what's new? And I wanted to share a few areas that are new. And if physician has a patient in front of them, how to show you how fast you could do that and how you could see uh, what are the trials that have released results and what are potential new options for treatment. And I'm not going to show everything, but obviously some what I would call hot areas where something new is appearing.
Go for it.
So we have Oncoscope and we just going to select, let's assume there's a patient in front of us with metastatic breast cancer that is HER2 negative, because majority of patients are HER2 negative. And you have tested that patients for various biomarkers and nothing came through as positive, nothing else to target. And that patient is not in visceral crisis at the moment. And majority of these patients, let's face it, have been treated with the CDK4/6 inhibitor. It is a very busy area right now, considering that palbociclib celebrated its 10-year anniversary. I couldn't believe it. I was uh, helping Pfizer with that launch a long time ago, and it's 10 years. So a lot of the patients have experienced a CDK4/6 inhibitor treatment because this is a standard of care. And that standard of care changed the world of HER2 negative breast cancer because these patients have been on this drug for years. And what is happening now, we'll see this at ASCO, we see this at many conferences. A lot of these patients are progressing, unfortunately, because it's not forever in metastatic stage. So what are the recommended treatments? I've selected here the treatment path, and I'm ready to look. And we are looking at the treatment categories here. These patients could be treated on endocrine therapy. You could see all the various endocrine therapies. These are category 2 in various national guidelines. They should be tested for biomarkers again and potentially be treated with the targeted therapy for specific biomarker. I'm going to address it in a moment, or the other category 2 treatments would be everolimus, which is an mTOR inhibitor. There is a new treatment that has been recommended by the guidelines quite recently. Not actually, sorry, it is not yet in the guidelines. It has shown positive results and presented recently, but it's not yet in the guidelines. And then another choice is chemo, as always. But as we know, chemo reduces patients' quality of life. So what else is out there for these patients who progress on CDK4/6 inhibitor? Well, we can look at the choice here, which is abemaciclib with fulvestrant, which is another CDK4/6, and it is in the green color here because it's not yet in the guideline, and it's, as a matter of fact, not yet approved. So I will select that because I wanted to share this data with you. It's important data. It is the data that has been presented from a randomized control study. So I'm going to select that portion and click on explore the results. And that gets us to the second page. And you could see that this is beyond the guidelines. This is new data, not yet in the guidelines. And there are various combinations with abemaciclib, but specifically there is a post-MONARCH study that compared abemaciclib combination with fulvestrant versus giving fulvestrant alone. And it showed, as we can see here in progression-free survival data, it was a statistically significant result. It was a statistically significant improvement in progression-free survival. So this is one of the choices that you can learn here. As in the tool, we don't just show therapies that are in the guideline or approved. But as I mentioned, for these patients, the guidelines recommend to retest these patients again for the HER2 status as well as for the biomarker. So my friend Susan, who is in this category, who I write about a lot, her doctor did exactly that. He retested her after this stage and found out that she's actually HER2 low. So I'm going to select HER2 low right here. And again, no visceral crisis. And we want to know what happened in this case when the patient had a prior CDK4/6. There is a new option for these patients, which is an ADC that is approved and is covered in the guidelines. So you could look specifically at that option, select that option. And there are two different studies. You explore results, and then you could see that this is in the guidelines, although not in the ASCO guidelines specifically. It is FDA approved. You could look at the label right here, right? And this is the study presented. So this is the Destiny Breast 6 study. And there's also a pooled analysis of multiple studies, just to show you that the Destiny, sorry, Breast 6 had multiple publications. You could see the results here on the overall survival as well as progression-free survival. And the most recent publications actually were presented quite recently. There was a subgroup analysis as well as quality of life analysis presented. You could look at all of these publications as well as the FDA labels.